Hi, Assalamualaikum. Today I will talk about developmental coordination disorder. Okay, I will explain what is developmental coordination disorder. Actually, it has been a clumsy child syndrome, clumsiness developmental disorder of motor function. Hmm, Actually, it's usually first recognized when a child fails to reach such normal developmental in milestone, such as walking or beginning to dress him or herself. Okay, now I will continue. What is the developmental coordination disorder? It makes it hard to do physical tasks and activities where the child is not able to perform well in their physical tasks or activities such as hopping, jumping, or running. And it can cause trouble with coordination to them to do like climbing, star jump, or another else. And then some people with DCD always struggle in fine motor skills such as in buttoning, um, like writing or typing shoes, and some of them also will have a problem with gross motor skill, like running or kicking a ball, and also them will able to struggle with both like fine motor skill and gross motor skills. Okay, now about trouble area of developmental coordination disorder. Actually, they have eight trouble that the children will having it. The first one is coordination and balance, where they are cannot have the right posture or balancing when they are doing the physical activities uh, in gymnasium, playground, or in sports. And the second one is in handwriting, where the children will so hard to write or typing and drawing because their hands are not matched well to writing or to do in fine motor skills. And the third one is they are having problem when they are tying their shoes, when they are not able to adjust the um, tying shoes, um, the right left when they are treat the when they are put the treat and to pull when before they are wear their shoes. And the fourth one is using scissors and utensils, where the child is so struggle to use the scissors, where they are needs to adjust their fingers to open and close, and other utensils that they are needs to moving their fingers or hands. And the fifth one is dropping or bumping into things. This one is they are so difficult to dropping or bumping because they are not able to know what's the effect of their actions. And the sixth one is brushing teeth, getting dressed, and other routines when they are needs to use their motor planning and their body parts. And the next one is riding a bike and playing sports, where they are not able to manage their hand and leg movement in the same time, and also they are not know to use their motor planning to move and to get the movement and the right coordination and balancing. And they are having problems also in driving because they are needs to focus and needs to move their hand and legs together when they are driving. Um, Now is about statistic of developmental coordination disorder. Um, the statistic shows that estimate as many as 6% of children between age 5 and 10 have developmental coordination disorder, and it means the population is so many among young children, and the male and the male and females are thought to be equally likely to have DCD. And DCD and speech language disorder seem to be closely linked, and children with one disorder are more likely to have the others. Mm, the intervention of developmental coordination disorder. Actually, no interventions are known to work for all cases of DCD, but some experts recommended that a specialized course of treatment that possibly involving work with an OT be designed to improve their child performance. This one like they are trained or they are educate the children with the with fine motor skills therapy, gross motor therapy, or course that will help the children enhance their skill. And also the intervention is special education setting to improve handwriting. Mm, where there are needs to give the young children the technique or strategy to help them to write very well and to enhance their handwriting skill. And the next one is physical education classes to improve general motor, like train the children with the um, information about the activities or tasks that will make them to apply in their life, such as how to do the star jump or how to do the um, wall climbing, that it will enhance their skill in gross motor. And it's also physical training that allows the child practice motor skill and motor control. That means practical training or practical class that that will um, involve the children with all activities that they need to do with the coach or in one-to-one setting to more systematic and more good for them. And individualized therapy focus on skill that useful on the playground or gymnasium, that will help the children to try all the things or the equipment at the playground or gymnasium to help them to use all the gross motor skill or fine motor skill that will help them to improve their skill. And the last one is the individualized program to help child master writing or skill related to art and craft. That means it may help them enhance their confidence and interest in classroom activities. Mm, and also it will help them to encourage their self-esteem also, mm, because they need to socialize and participate with peers in many games or sports or program and can lead to the good or enhance their social skills. Um, Conclusion about the developmental coordination disorder uh, yeah, actually is for many people. Developmental disorder lasts into adulthood. Mm, and also through specialized attention and teaching techniques, many children develop the motor skills that are lack. Um, because some children never fully develop the skills required in sports and other physical tasks, and also many children have improved their motor skills significantly. In most cases, their motor skill will never match those of their peers. This means that the DCD are not secure in their life. Okay, thank you.